The most important part of cancer screenings is early detection of cancer. We know definitively that earlier we can catch a cancer, regardless of the type of cancer, the more likely we are to cure that cancer or prevent a lot of the bad outcomes with that. If we are dealing with a patient that, say, has a diagnosis of cancer, there's few things that are more terrifying for the patient as well as the patient's family members. So we want to be really understanding of those needs to help guide that patient and their family in the right direction to get well. Part of screening isn't just having a test, it's sitting down and engaging with your physician, and we're going to be probing for certain signs or symptoms. What are you experiencing? Is there a change in weight? Are you not sleeping well? Is a relationship between the provider and the patient to try and understand certain symptoms that could be representative of cancer. Testicular cancer is one of the most common cancers in young men. And we want to, starting mid-adolescence, encourage men to do regular testicular exams at least once a month. If there's any abnormalities, including lumps or bumps that weren't there before, or if there's any new tenderness, we really want to have that patient examined by a primary care physician to determine if we need additional testing. Prostate cancer is the most common cancer in men starting at age 50. And we're going to start screening usually in the 40s or maybe earlier if there's a big family history. Colon cancer is the third most common cancer in men, and the key to detecting colon cancer is screening. Usually at age 45 is when we start having that discussion about colon cancer screening, but it's very important to know if you have a family history of that, we're going to recommend screening for colon cancer sooner. Skin cancer screening is also very important, and we want to see you for regular skin exams at least once a year, starting in your 20s. If you're a fair skin, if you have family history of skin cancer, or if you spend a lot of time in the sun, it's really important that we take a look at you. Skin cancer in men is the #1 cause of cancer up till age 50. Thankfully, we've had some advances in technology and have access to low-dose CT scans that can detect lung cancer in its very early stages. If a patient's between ages 55 and 80 and has a significant or long-standing history of tobacco use, we're going to worry more about lung cancer and recommend screening. A lot of men aren't aware that men can develop breast cancer, and if they notice abnormalities of the breast tissue or nipple, it's very important that we immediately discuss that with a healthcare provider. I can't stress enough how important early cancer screenings are to good outcomes. Despite all the advances in technology, the most important aspect of cancer care is early detection and treatment.